Cesarean section surgeries, or C-sections, to deliver babies are the most common surgical procedures in U.S. hospitals. Now, a new study of nearly 1 million births from 2008 to 2017 finds that black women are almost 25% more likely than white women to have unnecessary C-sections, needlessly putting them at risk of surgical complications. The study's from the National Bureau of Economic Research and was done by 3 economists. Now, the researchers looked for correlations. They couldn't find any correlations with medical risk factors, with the gender of the doctors, or the economic status of the mothers, but they did find one interesting correlation.
Yeah, the fascinating thing they were able to look at is what was going on in the rest of the hospital and if the operating room was empty. And I think this was probably the most interesting finding to me, was that when the operating room was empty, that's when black women were significantly more likely to have C-sections than white women. When the hospital was busy, people are rushing around, but if someone really needs that C-section, black and white women end up getting C-sections at near identical rates. It's when the hospital is less busy, when the OR is sitting there empty, that's really when you see these unnecessary C-sections happening on these black mothers.
I think by now most people know, or at least the information is there, that black women have a higher maternal mortality rate. But this information here, and this comes from PBS NewsHour, which hopefully more black people are tuning into this, but to know that we are not only have this higher maternal mortality rate, but that we are shoved into operating rooms for the bottom line for the hospital, for them to make money. Anytime you go to surgery, there's a risk. And so the hospital, of course, knows that there's a higher risk for us already in childbirth. But now we are being shoved when the operating room is empty for C-section. I did not get C-sections in either of my births, but I truly felt like I was not being listened to, especially with my oldest. Definitely with my youngest, I was older, I was more aware, I was more determined, and you were not going to tell me something that I didn't want to hear, didn't want to do. I was determined. So I felt more empowered, and I made sure my voice is being heard. Black women are being shoved into operating rooms during childbirth for the bottom line is money for the hospital. We are still being used, and our health is not a factor. It is not important. So if that operating room is open, they want us in there. So black women, please, please question, demand, force your doctors or hospitals to not force you to have a C-section if it's not necessary, because you are not here to serve their white dollars. You are not here for them to make money off of your body and your child's birth.